standpoint, is this going to make a difference?
Well, that's an important question. So, yeah, I mean, we know that the vaccines are effective at reducing the risk of serious illness. So they do reduce the risk of serious illness from COVID. So it will be effective in that respect. But the problem is that the reason that these mandates are being promoted is the idea that they will stop transmission. And we actually know that that's not what the science is saying. The science is saying that they reduce the risk of transmission, but they don't stop transmission. So this idea of implementing mandates so that the workplace can be safe is, it's politics that's not aligned with the science.
Yeah, you've long said managing to zero just doesn't work. Liberty, when you think about this, this all comes down to sort of forcing people, about 100 million people in all, to prove that they have the vaccine. Statistically, does that get us to the herd immunity number?
So the herd immunity number that people have been talking about is 70 to 80%. And, if we look at America right now, we have 53% of Americans vaccinated. If you think about maybe 100 million of those that are going to be affected by Biden's mandate, of those, let's say 50 million are currently vaccinated, so it won't affect them. So let's generously say that there'll be then 50 million left who will get vaccinated to add to America's number. That only gets us to about 68% of Americans vaccinated, which isn't even herd immunity. And we have a graphic to show you here that even questions whether herd immunity is 70 to 80%. If we look at other countries touting very high vaccination rates like Spain or Iceland, you still see these big spikes in COVID cases, just like in the US. And even Israel, which was touted to have the best original rollout, you still see these spikes.
Yeah,
so not only will these numbers not get us to the mandate, I think it's really questionable.
Yeah, now Israel's talking about you're only vaccinated if you had a third booster shot. Dr. Ladapo, I just want to follow up with Liberty 1 second. Next step would be some massive new lockdown, which in this case we can back test back to March and April in terms of whether a lockdown would work.
This is all a cost-benefit analysis. We have a graphic to show you the number of deaths, which is what people really care about, not the number of cases. And we are absolutely on a rise. But we also have very well-established methods to estimate how much society is willing to spend to save a life. It's something people don't want to talk about, but we put a dollar value on human life all the time. Life insurance companies value a life at $50,000. The Department of Transportation values a human life at $9.6 million. And if the cost to implement whatever this safety measure is too much, it's not implemented. So we need to convert the number of deaths that would be prevented by COVID mandates into a number value, and then compare that against how much the mandates have cost with domestic abuse, suicides, overdoses, lost business, loss of GDP. And we really make a comparison about how many lives we're willing to lose to COVID-19 versus how many lives we're willing to lose or ruin to the mandates. And once that data is there, it can only bring us part of the way.
Then it really becomes a political decision rather than a medical decision. You take the science and the data, and then you make a political decision. I'm not really sure whether President Biden was making a political point or more of just a shaming point when he said this today. Take a listen.
We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. But our patience is wearing thin, and your refusal has cost all of us. So please do the right thing.
Dr. Ladapo, you study public health and how to convince people to make good decisions. Does the president's soundbite there help that cause?
Right. So I don't think it helps that cause. I mean, I think you're right in terms of reading between the lines. He's sort of using shame as a strategy, implying that people aren't doing the right thing by if they don't choose to receive the vaccine. And I'm a doctor. I love good health. I want people to be in good health, and I think good health is wonderful. At the same time, it's obviously important to respect the fact that individuals are individuals and people do have control over their bodies. I mean, they have sovereignty over their bodies. And this is being lost in these conversations and these points that people like the president are raising. So that's something that we have sort of recognized in clinical medicine in the past, that people have a right to make a decision, even if it's a decision we don't agree with. And it's something that some public health officials are trying to convince us it shouldn't matter anymore. And that's, you know, it's important, and from my perspective, to remind people that in fact it does matter, and people do have a say over what they do with their bodies, and that will never change no matter how many times the president or any other public health official says that they don't.
It's interesting, even the ACLU now, conceivably the people who are supposed to most protect our civil liberties, has flip-flopped on whether or not vaccine mandates and forcing people to get vaccines should be allowed. Speaking of that, Doc, you're out in...
And Leland, I'm so sorry to interrupt. Can I...
Please.
I'm so sorry. I just want to add one other point to what Liberty said, and hopefully I'll have an opportunity to meet you in person one day, Liberty. So there was a study that came out of the National Bureau of Economic Research, so just an outstanding research institute, and many people didn't hear about the results. It was about lockdowns, and people didn't hear about the results because the results didn't fit, you know, sort of the agendas that we're hearing about. But in fact, it was an analysis of lockdowns last year, and the study found that, in fact, after lockdowns, mortality rose. So this idea that, you know, we're saving lives by lockdowns is absolutely not backed by science. You do decrease COVID illness, but there are costs, just as Liberty mentioned, that, you know, we're not hearing about, but they're real and they don't save lives. That, at least so far, that's what the evidence says.
Yeah, and you also have people who don't get treated for all sorts of deadly diseases, from heart disease to strokes to cancer screenings. In the like. Doc, I got about 15 seconds. I just want to real quick. Vaccine mandate for students 12 and older in LA public schools. Would you tell your kids to get vaccinated?
Oh, I absolutely wouldn't. So I have 3 boys. My oldest is 8, so he's not eligible anyway for any of the existing vaccines. But, you know, just to briefly mention, Leland, another example of a separation between science and policy. The CDC did an analysis of the sort of cost-benefit of vaccination in adolescents after there were, you know, national concerns about myocarditis. And what they did actually was astonishing. So on the risk side, what the CDC did was they used the estimates of cases in the VAERS database, so the Vaccine Adverse Event Reporting System database, as the incidence of myocarditis. And the reason that's astonishing is because that's not the incidence of myocarditis. The incidence of myocarditis is whatever it is in the community, and it includes both cases that are reported and cases that are unreported. So that's how they concluded that there was a benefit.
You said it best at the very beginning, no, which is terrifying from a doctor who studies these things, as decided by politicians.
The cost-benefit isn't there.
Yeah, well, it's important. We're going to actually get into sort of some of the numbers in terms of how many kids died from COVID around the country a little later in the show. Liberty, Doc, appreciate it. Thank you very much, as always.
Thanks.
Good to see you both.
Thanks.
President's domestic agenda.